Hello, everyone. We are thrilled to have the opportunity to talk to you today about a crucial topic in cancer research: cachexia, drug resistance, the roles of cytokines and exosomes, and how we can potentially overcome these challenges in advanced cancer cases. What makes this discussion particularly intriguing is that we'll be exploring an age-old method, specifically plasmapheresis, with new insights from recent research. As we know, cancer is a formidable adversary, and it doesn't stop at just tumors. Cachexia may be a word you haven't heard before, but it's a significant issue for individuals battling cancer every day. It leaves them feeling weak, fatigued, and often robs them of their appetite. We'll begin by understanding what cachexia is, and why it poses a serious concern for cancer patients. We are also going to talk about another related issue: drug resistance. Imagine trying to extinguish a fire, but no matter how hard you try, the flames keep reigniting. In cancer treatment, we encounter a similar challenge. Tumors can develop resistance to the drugs we use to combat them. It's a real puzzle, but together, we'll work to solve it. To unravel the mysteries of cachexia and drug resistance, we must familiarize ourselves with two crucial players: cytokines and exosomes. Picture cytokines as tiny alarm bells that signal trouble within the body. Exosomes, on the other hand, are like minuscule delivery trucks that shuttle messages between cells. These two components can cause a multitude of problems in the context of cancer. The exciting aspect of our discussion today lies in discovering methods to eliminate these troublesome cytokines and exosomes. If we can achieve that, we may just be able to shift the balance in favor of individuals facing advanced cancer, mitigating the effects of cachexia and drug resistance. So, let's embark on this journey together. By the end of our conversation, we hope to provide you with a clearer understanding of how we can enhance the lives of those confronting advanced cancer. Thank you for joining us on this quest for knowledge and hope.
Cachexia causes a major drop in weight, makes you feel really tired, and takes away your appetite. Recent research has given us a better understanding of what's behind all of this, and it seems like cytokines and exosomes are the main culprits. Think of cytokines as tiny messengers and exosomes as these little packages of signals and proteins that are released by tumor cells. These things come from within tumors and can have serious effects on our bodies, making us feel exhausted, losing our muscle mass, and shedding pounds. What's even more concerning is that these cytokines and exosomes from tumors can set up a vicious cycle, making the tumor grow more and even making it resistant to drugs. If we could remove cytokines and exosomes from our bloodstream, it might be possible to stop the tumor's growth. This could present a promising solution to address both cachexia and drug resistance, offering hope to over 80% of cancer patients. In just a few minutes, I will demonstrate that this is a realistic and achievable goal.
So, can we technically remove those cytokines and exosomes from our body? The answer is a definite yes. Thanks to another exciting discovery from Mayo Clinic, researchers have found an efficient way to remove cytokines and exosomes. You can see a significant drop in the levels of these substances in the blood after a specific procedure.
Now, what's the procedure that miraculously removes all those harmful substances from our blood? It's called plasmapheresis, sometimes referred to as plasma exchange. Here's how it works: the patient is connected to a machine through a blood draw and an intravenous line. The blood is taken out of the body, separated within the machine, and the cytokines and exosomes are separated from the healthy part of the blood cells. Then, the healthy blood cells and plasma are returned to the patient, while the toxic cytokines and exosomes are discarded. Here, I'm showing you one of the machines. It might resemble a dialysis machine and functions similarly, but there's a key difference. Dialysis primarily removes small chemicals like urea from the body, which act as toxins causing end-stage renal disease. On the other hand, plasmapheresis is designed to remove large proteins, such as cytokines and exosomes. These proteins are responsible for conditions like cancer, cachexia, and tumor growth. Now, we understand that cytokines and exosomes play a significant role in cancer-related issues, and we can indeed remove these substances from the body. But the big question is whether plasmapheresis can actually shrink tumors and help cancer patients overcome cachexia and drug resistance. Well, the answer is a resounding yes. Let's take a closer look at some early clinical studies that support the idea that plasmapheresis can eliminate toxins, specifically cytokines, and potentially alter the way the body responds to cancer. The role of plasmapheresis in cancer care was explored in a study carried out at Mount Sinai Hospital in New York. In this study, researchers were investigating what they referred to as blocking factors, which are essentially similar to what we now call cytokines. Back in 1977, they conducted a pilot clinical study involving patients with advanced cancer. The study included 27 patients, consisting of 24 individuals with advanced cancer, 2 post-operative cases, and 1 patient in complete remission after chemotherapy. The results of this study were quite surprising. Out of the 23 patients whose responses could be assessed, 8 of them showed a partial objective response to the plasmapheresis procedure alone. These improvements were seen within 2 to 3 weeks after the initial treatment, and the responders included patients with breast, colon, thyroid, and melanoma cancers. What's even more remarkable is that the procedure was generally well tolerated, even in patients with advanced stages of cancer. The researchers suggested that the clinical improvements observed in certain patients could be attributed to the removal of blocking factors from their bloodstream, including specific and nonspecific acute phase reactants. Let's start by examining a specific type of cancer, beginning with breast cancer. In the case of breast cancer patients who responded to treatment, all of them had extensive anterior thoracic involvement, which showed up as subcutaneous infiltration and numerous skin nodules. These nodules varied in number, ranging from 20 to 100. After undergoing plasmapheresis, there were significant improvements. Notably, all the skin nodules decreased in size, and some even disappeared completely. Moreover, the subcutaneous infiltration reduced, and for the 2 patients with lymph node involvement, the size of these enlarged nodes decreased by more than 50%. Subsequently, 3 out of the 4 patients received daily intravenous treatment with Cryptosporidium parvum for 4 weeks, followed by chemotherapy. At their most recent follow-up, which occurred at 19, 20, and 23 months respectively, 3 patients are still alive. One of them has achieved a disease-free state, while the other 2 continue to live with the disease under control. Now, let's explore the outcomes related to colon cancer. 2 patients were diagnosed with colon carcinoma. One of them had a large palpable cecal tumor causing partial intestinal obstruction. The liver was also enlarged, positioned 10 centimeters below the ribcage, and the patient had jaundice along with multiple metastases in the liver as shown on scans. The prognosis was extremely poor, with a life expectancy of less than a month. After undergoing plasmapheresis, remarkable changes took place. The cecal tumor started to shrink, the enlarged liver reduced in size, and the patient's overall health significantly improved. Subsequently, this patient received parvum treatment for a month, followed by chemotherapy. The regression continued, eventually leading to a complete response. Remarkably, even 20 months after the plasmapheresis, the patient remains fully active with no signs of tumor. In the case of the second patient, the abdominal wall was extensively involved, featuring a 15 cm diameter ulcerated lesion. Following plasmapheresis, the lesion began to heal, becoming shallower, and its size decreased by about 30%. Recognizing the challenges in treating metastatic melanoma, especially before the era of immunotherapy, researchers have reported an exceptional case that illustrates the effectiveness of plasma exchange in achieving a clinical response in a melanoma patient, all without resorting to chemotherapy. The patient in question had numerous subcutaneous nodules, some as large as 5 centimeters in diameter, scattered across the abdomen, thorax, and forehead. After 6 plasma exchange sessions, a notable reduction in the size of these nodules was observed, with one of them nearly disappearing. With an additional 6 sessions, further tumor shrinkage occurred. Moving on to the final patient, they had small disseminated bilateral pulmonary metastases due to thyroid carcinoma. After undergoing 6 plasmapheresis sessions, there was a partial clearance of these metastases. However, Despite this initial improvement, the condition later worsened while the patient was receiving chemotherapy. Most importantly, chemotherapy resistance can also be addressed through plasmapheresis, as demonstrated in a comprehensive study conducted by researchers at the University Medical Center Göttingen. Their investigation revealed that the toxic substances responsible for chemotherapy resistance can be effectively removed through extensive plasmapheresis procedures. In this study, a total of 69 chemotherapy-resistant patients underwent the treatment, and results indicated a positive response in 53.6% of them. The most notable clinical improvements were observed in patients diagnosed with colorectal cancer, with 15 out of 23 individuals experiencing enhancements in their condition over a period ranging from 4 to 45 weeks.
In conclusion, plasmapheresis isn't just another treatment option. It's a ray of hope for cancer patients and has the potential to revolutionize modern cancer therapies. In an era where we have various effective treatments such as chemotherapy, targeted therapy, and immunotherapy, the unfortunate reality is that almost all treatments eventually lead to resistance, leaving many cancer patients with limited options and hospice care as the last resort. Plasmapheresis represents a contemporary renaissance in the realm of current cancer treatments. Its non-toxic approach sets it apart from conventional treatments, which often come with debilitating side effects. Instead of bombarding the body with chemicals, this method focuses on purification, cleansing the blood of harmful substances to halt tumor progression, even in advanced cancer cases where traditional chemotherapy may falter. What's truly remarkable about plasmapheresis is its dual impact. It not only offers a potential way to stop tumor growth but also addresses the often distressing symptoms of cancer. By removing cytokines, it has the potential to alleviate conditions like cachexia, significantly improving a patient's quality of life. This symptom management is crucial, as it not only eases suffering but also empowers patients in their battle against cancer. Furthermore, plasmapheresis may hold the key to solving one of the most challenging issues in oncology: chemotherapy resistance. By purifying the blood and removing substances that contribute to resistance, it may help chemotherapy regain its effectiveness, offering renewed hope for treatment success. In the realm of immunotherapy, plasmapheresis shines as well, potentially enhancing the immune response in patients who have developed resistance to these therapies. By reshaping the immunological landscape within the blood, it opens doors for more patients to benefit from advanced cancer-fighting strategies. To sum it up, plasmapheresis is not just a medical procedure, it symbolizes innovation and progress in medical science, offering a gentler, more humane approach to cancer treatment. It provides real, tangible benefits to patients available right now, not in some distant future. This approach is reshaping the landscape of cancer care, providing a safer, more effective treatment path, and improving the lives of patients precisely when they need it the most. Importantly, it's not just a promise for tomorrow, it's a reality offering tangible benefits to those currently facing the challenges of their cancer journey. This is indeed a modern renaissance in cancer treatment, a true revolution that's changing lives today.
In the face of cancer, we understand the physical and emotional challenges you may be going through. If you find yourself on hospice care due to your deteriorating condition, limited progress on chemotherapy, or exhaustion of treatment options, it's essential to explore every possible avenue for improving your quality of life and potentially extending it. At Omega Precision Oncology Clinic in Houston, we offer a unique approach to combat cancer-related complications like cachexia, severe weight loss, and drug resistance. Our treatment options, such as plasmapheresis, among others, can make a significant difference in your journey. As we just learned, plasmapheresis is a technique that involves separating and removing harmful factors from your bloodstream, such as cytokines and exosomes, which play a role in cancer progression, cachexia, and drug resistance. By addressing these factors directly, we aim to halt the tumor's growth, alleviate cachexia, and potentially improve your response to chemotherapy. Don't let despair overshadow your hope. Take the next step towards a brighter future by reaching out to Omega Precision Oncology Clinic today. Our compassionate and experienced team is here to discuss how our advanced therapies, including plasmapheresis, can be tailored to your specific needs. Your fight against cancer is not over, and we are committed to helping you in your battle. Call us at 713-797-1900 and let us explore the possibilities together. Your journey towards a better outcome starts with a single call to Omega Precision Oncology Clinic.